Sigue en sintonía de nuestra programación.
Ahora empieza su programa, el show del Dr. Roy Aranda. Temas sobre los efectos que tiene la separación de los niños de sus padres, traumas que afrontan los indocumentados, violencia doméstica, el porqué de la violencia en las escuelas. Llámanos en vivo al 1-888-900-2811, extensión 6, y haz tus preguntas al aire. ¡Comenzamos!
Good evening, my dear Tribuna TV viewers. Here we are again, 1 month later, October 24th, 2019, and it's Thursday, and I want to welcome you all here. Felicidades, mis deseos. Gracias por estar aquí todos los televidentes del programa Tribuna TV. Me gusta mucho, me encanta que estén ustedes aquí presentes hoy. Today we have a very exciting and extremely important topic, and a wonderful, wonderful guest who I'm going to introduce you and tell you a little bit about him momentarily. Tenemos un invitado, una persona muy querida. Voy a comentarles en un momento quién es. El tema para hoy vamos a estar hablando de ángeles con alas rotas, niños que enfrentan enfermedades y los cuidados preventivos. In English, angels with broken wings, children coping with illness and preventive care. I did want to give a shout out to my good friend, Dr. Peter Canaris, who came up with the title. He gave me this great title, Angels with Broken Wings. And I also wanted to mention that when he suggested Angels with Broken Wings, and I'm going to tell you why I came up with that title, I thought to myself, Ángeles con hambre. And I remembered this, and this is something that I'll mention briefly the significance of that. Voy a mencionar el enlace de ángeles con hambre en un momentito. So the guest for today, there he is. Hola, ¿qué tal?
Hello.
How are you?
Good, thank you.
Is my guest for today, and I do want to mention, by the way, that the show is being recorded live. It's already been recorded on YouTube. It will be available tomorrow on the 25th of October, through Tribuna TV, the Tribuna TV website, Vimeo, Facebook, and other social media networks. Okay, so it is available. We have 9 educational slides to be informative to the viewers, that you're welcome to freeze the frames and reproduce them, copy them, review them. It's meant for your educational use. So I wanted to, without further ado, introduce Dr. Carlos Monzon. And the way that we know each other, he's my senior. He is a whole 2 weeks older than me. We have birthdays coming up in December. So just briefly, his family and my family met in Guatemala. My parents had emigrated from France to Guatemala. My mother had studied medicine in France. And Carlos is, ¿puedo llamarte Carlos? ¿Es okay? ¿O tiene que ser Dr. Monzon?
Absolutely, that's the perfect way.
Okay. So his father, same name, was the chief of pediatrics of a major hospital in Guatemala, and my mother went to work there, and they became close friends. She worked for that department under him, and the family has since maintained a friendship. I'm not going to tell you how old we are, just that he's 2 weeks older than I am. So he's my senior. The film the title that I was referring to, Ángeles con hambre, Angels Who Are Hungry, it was his father's, Carlos's father's creation, basically. And he made this award-winning short film that was, for its time, something really astonishing. And I remember we used to watch it over and over and over again, and it was like really remarkable about children who were hungry and the kinds of needs that they needed. And when those dietary measures were taken care of, the children thrived. So that was the enlace. So Dr. Carlos Monzon, he became a pediatrician, and he's pretty stellar. I mean, he's got quite a number of accomplishments. He's published several publications. I just want to briefly give you a little bit of background, and then I'll let him introduce himself more fully. So he has specialized in pediatric hematology and oncology, pediatric anemia and red blood cell hematology, pediatrics and adolescent medicine, an expert in thalassemias, which you'll have to explain what that is, refugee health, pediatric hemoglobinopathies, I think I pronounced it okay, hereditary red cell disorders, gene frequencies, and he's had a number of licensures in several states, affiliations in many different locations: University of Kansas, Kansas City, University of North Dakota, University of Missouri. His educational background is stellar, going back to the Universidad de San Carlos, FOMS, in Guatemala, and also education, University of Missouri, Columbia, Minnesota, the Twin Cities, Mayo Clinic of Graduate Medical Education, University of Missouri. He's the recipient of multiple awards. He's a fellow of the FAAP, American Academy of Pediatrics, a top MD. He's also acknowledged by the who's who in medicine and healthcare, and I'm going to cut it short on the publications because some of these things are hard to pronounce. So, Dr. Carlos Monzon, please take it away. I'm so delighted that we, after all of these years, we are doing something together again. That is so cool. So please introduce yourselves and take it away.
Very good. Thank you for inviting me to your program. It is a unique opportunity to be with you here tonight, and it is a pleasure to be part of this dialogue. Yes, I can divide my professional career in two parts, in two chapters. My initial chapter was in pediatric hematology oncology. And pediatric hematology oncology is a specialty that diagnoses and treats children with blood disorders such as anemias, sickle cell anemia is one, or bleeding disorders such as hemophilias. Also, it is a specialty that diagnoses and treats children with malignancies, with cancer, such as leukemia and other solid tumors. The second stage of my career was in pediatrics and adolescent medicine. I would like to define, because of the discussion tonight, what a pediatrician is. Pediatricians are concerned with the physical, with the mental, with the social health of children from the onset, from birth to young adulthood. They monitor their growth, they monitor their development, and they diagnose acute and chronic conditions. They also provide with preventive health. Overall, they provide education about any health concerns that families and children can have. So this is my introduction, and we can further our comments with our presentation tonight.
Okay. So I had promised to mention what inspired the title, Angels with Broken Wings. And the reason, is, si Oscar, por favor, primer slide. I was very much inspired and moved by the recent news approximately 3 months ago of children who were children and young adults who were being who received letters indicating that in 33 days, if they didn't voluntarily leave the United States, they would be deported. Now, these were children who had, and again, young adults who had, who were granted medical deferred action. They had permission to be in the United States, and they presented with very complicated medical cases. ¿Se puede ver la foto de la muchachita?
No puedo.
So one of these, and I'm just going to mention, is Maria Isabel Bueso, 24 years old, and she originated from Guatemala, and she suffers from a rare disfiguring genetic disease. ¿Se puede ver la próxima slide o no sale?
Sí.
And slide 2, okay. Right, and part of my inspiration also was realizing the plight of medically ill children separated from a family member and the significant impact that it has to them, not only emotionally, but physically. Reading from the top, medically ill children separated from families suffer emotionally. When parents are not present, the adverse effects of hospitalization on children are stronger. And one of these children, adolescent, Ixel Sandoval Perez, 14 years old, battling leukemia, was facing treatment without her mother at her side. And keep in mind, this is a 14-year-old. And she had to face this without the support, emotional support, physical presence, closeness of her mother, who recently was granted a temporary humanitarian waiver and was able to see her daughter. So this is really what inspired the show. So what I wanted to do now is to talk. We're going to focus, Dr. Monzon and I, we're going to focus on severe life-threatening illnesses. I'm just going to give you a walkthrough of some of the things that we're going to be talking about today. Your more typical common illnesses that children and adolescents face. This is like really open to everybody. I mean, every parent who has a child will have to face taking care of children's illnesses, and hopefully it won't be that it's something severe, serious, or life-threatening. We're also going to discuss an area of significant concern, obesity, one of the most disturbing problems worldwide, which creates all sorts of health and emotional issues. And I believe that in the United States, it's considered a very significant and serious problem area for pediatrics, in terms of health issues and mental health issues affecting children. We also will be talking about preventive services. This is something that hopefully will be educational and informative to all our viewers. What are the kinds of things that need to be done to make sure that your children, stay as healthy as possible, or if there is an illness or something happening, that you tend to their needs as quickly and expeditiously as possible with qualified professionals. And in terms of things that can be done, because I always, for those of you who've been on the show before, you'll know that I always like to give some sort of recommendations moving forward for the public in terms of things that they can do. What are some of the kinds of suggestions or thoughts that people can do and implement themselves, taking into consideration some of the things that we talked about on the show. So we will focus towards the end of the show on helping your child cope with the stresses of being ill, how to how to build something that's known as resilience. And I'll discuss that. We'll talk about what resilience is. And then lastly, we have several references that are available to the public, professional organizations that you can turn to, a book on developing resilience that I'll also share with you, and also a commentary about who can receive medical treatment in the United States. So, ¿me puede pasar, Oscar, por favor, el siguiente slide, que es los problemas graves. I'm all over the place here with my pages. So. Okay, slide number 3. I did want to also share with the public that this is hardly an all-encompassing, complete list. Okay, this is very brief, very abbreviated. I really wanted to focus on general kinds of categories: infectious diseases, HIV, leukemia, lymphoma, several blood disorders. Dr. Monzon already mentioned sickle cell, hemophilia, thalassemia, and brain tumors. So, Dr. Monzon, por favor, Dr. Monzon, please, Carlos, just take it away, focusing on some of the more severe kinds of illnesses. Then we'll get into the typical, more ordinary
Sure. I would like to reiterate the fact that these two youngsters that have motivated the show suffer from very complex and serious conditions. Maria Isabel Bueso has been diagnosed with this very rare and disabling genetic disease called mucopolysaccharidosis type 6. It is a condition that is very serious, that only in very specialized centers can be treated. Michelle Sandoval Perez also has been diagnosed with a very serious condition, which is leukemia. It is treated with chemotherapy. It is usually a very aggressive and intensive type of treatment they receive for years. 2 or 3 years is kind of the treatment plan that these patients have. So they're vulnerable, they're weak, they're helpless, and they need family, they need friends, they need their community for support. And it is the struggle that they have every day. So it is important that we recognize how serious these two youngsters are and how important it is the support that anyone can provide to them.
Their treatment needs here in the United States fall under the umbrella of humanitarian care. We have facilities in the United States that are superb and are able to provide necessary care and treatment to keep these children and young adults alive. In return, because I do want to point out that there are learning centers. We have teaching hospitals, research learning, so that some of these children, thanks to their being patients in the United States of doctors in hospitals, are able to provide valuable information so that we're able to use and develop our own skills. But I did want to emphasize, and I wanted to know if you agree, I pretty much referred to their being removed from the United States. A deportation to their country of origin would be really the equivalent of a death sentence.
It is difficult because those countries don't have the facilities, don't have the technology that they need. The treatments are very complex, are intensive, and the underlying technical support is not there. So it is in a tertiary care center, university center, or children's hospital that those patients that have complex and very disabling conditions are destined to be. And as far as we know, those facilities in our underdeveloped societies don't have that. That technology is not there, the medical knowledge is not there, the science that supports that is not available. So yes, it is a moral duty, or it is our task to offer support and advocate for what they have and how to help them.
I also wanted to give a shout out to the viewers who are parents and who may have children who are suffering from severe, serious diseases, or who perhaps themselves faced serious diseases or are actually even facing severe diseases presently. I did want to give a shout out that there are many wonderful hospitals that provide incredible care and treatment. That it's a shout out to say thank you to these facilities. Many of them depend on donations, like St. Jude's, for instance, that they don't charge any of the children anything. So it's just something I just wanted the public to be aware of. The donations, to be kind. It's not something that most people, I think, are that aware of, unless they actually are living through it, or have lived through it, or have had children live through it. What's involved, and many of these hospitals really go out of their way to provide social services and playrooms and all sorts of activities and theaters and religious services and all sorts of kinds of support and apoyo. Oscar, por favor, slide 4. We're gonna focus now on some of the more typical kinds of problems that we see on a day-to-day basis with our children. Children will complain of stomach aches, abdominal pain, constipation, coughing, diarrhea, ear infections, fever, flu, nausea, vomiting, pink eye, rashes, respiratory problems, sore throats, urinary problems, chicken pox. There's probably pages and pages that I could fill out of diagnoses, but these are some of the more common things that we see. So, Dr. Monzon, any comments on these kinds of illnesses and
Fortunately, those conditions are treatable, and they are self-limited. They go through a natural course, and in the hands of the professional and the guidance that they provide, those are eventually resolved. And so in terms of recognizing those conditions is what it is important. When a parent or a relative sees a child with something that is not the status quo and the normal child, they ought to consult. They ought to ask and seek medical care.
So, of course, I mean, it's important, and we all know that children who go to school, they are required to submit a medical note that they've been cleared medically, so that it's something that we're all aware of. Later on, I will point out some concerns in the area of proper prevention. You'll be shocked when you hear. Unfortunately, some of the large numbers of people residing in the United States who do not have access to insurance and do not have access to proper medical care and attention. We'll do that a little bit later in the show. A topic that I had mentioned in the introduction, that's something of very serious, or I think it's significant concern. Slide 5, el 5, obesity in children. ¿Me puede pasar la 5? Okay, so I had already in the introduction mentioned that this is one of the most disturbing problems worldwide. Causes health and emotional issues. Some of the emotional issues, some of the combination of emotional and health issues, anxiety, depression. Anxiety, you feel nervous, depressed, you're down, you're sad. You're victims of social humiliation, isolation. You isolate yourself from family members, from loved ones, from friends, peers, teachers. You don't want to be around people. You develop low self-esteem. You could be the victim of school bullying, either face-to-face physical bullying or cyberbullying. Lately with social media, many of these children are victimized through social media. Emotional eating. So, of course, part of the problem with the overeating could be an emotional reaction, something emotional that's triggering it. stress eating, nervous eating, development of eating disorders. The children who are obese could be discriminated from activities, from sports, from joining clubs, from being around other children, their peers in their classroom. You'll see increased frequency of school absences for a number of reasons. The child may not want to go to school, may be upset, may start crying, may complain of stomach aches. The child also may be physically not well, which prompts an absence from school. Because of the obesity, you can develop difficulty walking. I'm pretty sure, and Dr. Monzon, you'll tell me if I'm accurate or not when I stop. I'm guessing that probably because of the excessive weight, they may develop problems with joints. They may start getting early onset symptoms that are like arthritic conditions. Breathing problems, you're carrying so much weight, the heart is forced to work harder. Hormonal imbalances, early onset diabetes, and cardiac problems. So, Dr. Monzon, your wisdom, please.
Thank you. Obesity in children is caused by a combination of genetics and lifestyle. We can do something about lifestyle. We can have more physical activities. We can exercise. We should try to do more outdoor engagements and food choices. So those two are variables that influence greatly obesity. Obesity is a serious problem in our society and worldwide. It has a rate of complications that are very, very significant. For example, complications of obesity can be hypertension, heart problems, stroke. We can see also type 2 diabetes, high cholesterol. We can see changes in the liver, which is caused fatty liver. In the chronic course of this, it can produce irreparable changes. It can also produce gallbladder problems, gallbladder stones, and as Dr. Aranda mentioned, sleep apnea, chest problems, breathing problems, and arthritis. So obesity is a serious problem in our society, in our children, that we need to monitor closely and find a way to help these patients.
So in essence, then, we really need to partner up. I mean, we need to partner psychologists, social workers, teachers, parents, pediatricians, other medical specialists that work with, maybe thyroid issues or hormones. We really need to have some sort of a partnership.
Exactly. It is a team approach. It is a multidisciplinary treatment that these individuals would require, because if they have diabetes, that needs to be addressed. If they have arthritis, that needs to be addressed. If they have sleep apnea, that needs to be addressed. If they have hypertension. So all that involves a multidisciplinary team in which the psychologist also plays a fundamental role, because he's the one that will work with these patients, trying and attempting to help their mindset. The lifestyle changes are a big part of what it causes obesity. About genetics, we cannot do much about it. We are who we are, but definitely lifestyle changes are changeable. Activity and food choices.
The obesity itself, having obesity, I'm pretty sure that there are definitions which we're not going to get into, like what, how much body mass or how you measure it. I'm sure that there are definitions. But my question is, if somebody, or you have like a pediatrician or a child who is looked at and is given this diagnosis of you are obese, is that a risk factor for a shortened lifespan?
Yeah, longevity is compromised by the complications of these people. Diabetes can have also complications, renal complications, eye complications, circulation complications. So the longevity is compromised seriously by just the fact that overweight and obesity are present.
And having these medical complications at an early age is probably something that becomes riskier as you get older. I mean, if you as a child end up developing the diabetes, it's more serious than an adult who is 50 years old and sees his or her doctor and they do blood work and the doctor says, hey, you're pre-diabetic, and then after a while, well, you have type 2 now, but I'm sure that you're running into riskier forms of diabetes and greater likelihood of becoming, insulin dependent or dependent on several shots or different use of medications in a day, as opposed to just dietary measurements and keeping a monitor of it.
Mm-hmm. Yeah, early intervention is crucial. The longer the condition persists, more complications. Longevity decreases significantly with that. Yes.
Yeah. Well, I know the story of a young man. He's only 40 years old, and overweight. Because of the overweight, he developed problems with sleep apnea, problems with the back, thoracic. He required a thoracic surgical procedure. There's possibility of cardiac compromise because of the obesity, but significantly not properly taking care of dental care, and that's something that we're going to talk about under preventive care. At a young age is facing very significant dental problems, and I'm pretty sure people may not be aware of it. The public at large. It's not just a matter of you wanting to smile and have a nice smile. I'm pretty sure that when you have infections, dental infections, it can actually be life-threatening. You can have cardiac complications from the dental problems. So that was just an aspect that I did want to point out, because you were saying that the longer that this thing goes on without some sort of taking care of it, the more likely you're going to have problems. So the child who is maybe obese or is already gaining weight, and the parents are not stopping eating las golosinas, cupcakes and chocolate and some of the the high sugar loaded kinds of foods, you're not doing your child any sort of a service. You have to, parents need to know how to monitor and take care, and what's a good diet and what's healthy, and make sure that they get exercise. Taking your child to a doctor is part of it, but the lifestyle, making sure that your child gets adequate sleep, proper diet, is moving, actively involved in moving, that's probably even more important, if not just as important. Not just as important, more important. Okay, so let's focus this, since we've already opened the door into the topic of prevention. Let's look at slide number 6. So let's look at preventive services. This is really the gold standard of good, proper medical care and intervention. I did want to preface that at the top, from the Centers for Disease Control, CDC, they indicate that millions did not receive key clinical preventive services. For instance, things like not completing a formal screen for developmental delays, not receiving dental care, not monitoring blood pressure, not receiving recommended vaccines. Some clinical preventive services include newborn hearing screening, developmental screening, vision screening, lead screening. Yeah, I'm sure that the public at large has heard so much already about lead poisoning, but it's still out there. It's still there. Hypertension screening, preventive dental service, substance use screening, and then counseling if in fact there is some sort of an abuse, prenatal breastfeeding counseling, and reproductive health services. So I couldn't fit anything else, Dr. Monzon, on the screen, so I leave it up to you to talk a little bit more about it.
Right. I would like to have a comment about immunizations. The availability of vaccines to prevent certain infectious diseases has been a success story in preventive medicine. They are safe, they are effective. Many diseases that decades ago were serious, life-threatening, or lethal can now be prevented through vaccines. Examples of serious infections are measles. We've seen this year over 1,000 cases of measles in the United States. Whooping cough, polio, tetanus, hepatitis A, hepatitis B, certain types of meningitis, and HPV. HPV is an infection. HPV stands for human papillomavirus. This is a virus that causes cervical cancer and oropharyngeal cancer. These infections can now be effectively and safely prevented through immunizations. The World Health Organization states that over 25 infectious diseases can be prevented through vaccines. Routine preventive care at the health department or through the doctor, the family doctor, family practitioner, or pediatrician, they can offer and will give vaccines for 17 of these conditions, measles, diphtheria, polio, tetanus, that will be given on a given schedule and are in many states, fortunately, mandatory. So it is important that we pay attention to immunizations in children because they do help prevent very serious conditions that in the past were lethal. So the health department is a resource we have in most counties, and also the family doctor will be available to counsel and provide those vaccines to anyone.
What would you say to parents who may be somewhat reluctant or hesitant or say, I don't let my child out of the home that often, I'm doing homeschooling, they're not exposed to sick children, I don't think they need it, I think that the vaccine is risky, big pharmaceutical companies are just making money out of it. What would you say? What sort of, because I'm pretty sure that we see this, I've certainly seen this in the news and I'm aware of it. What would you say, to parents, or what sort of guidance could you give to the viewers who may wonder about this?
Will always happen. An exposure going to a public place, to a restaurant, to a shopping center, to church, a community that gathers people, mostly in the wintertime, that we are more indoors. So it is kind of unrealistic to think that keeping a child at home will protect them, because the exposure is there. Someone will bring germs from the street. The child will be exposed going outside, playing with a friend, playing with another relative. And so that is how these cases and small epidemics occur, the measles epidemic that we've been hearing about. And there are other epidemics that in the past have produced chaos. So it is not right that we think that way, because the exposures are everywhere. And they're mostly airborne. And So we have to say and reiterate that vaccines are safe. They are efficacious. And so all the arguments and with the technology that we have now over the many decades of vaccine development, they have proven all that. So it is to encourage and try to work with these parents that oppose vaccinations and convince them that they are safe.
When we talk about preventive services, I see several prongs. I see at the very basic beginning baseline threshold, if you will, making sure that at certain ages the parent complies or takes the child for certain kinds of vaccines, treatments with the pediatrician, and so forth. Just you want to ahead of time, you want to follow a certain kind of a schedule. I'm pretty sure that that parents can be well advised, and hopefully through pediatricians' counsel as well, to jot things down, write things down, keep a little health book for their children, keep a record of when they had a visit with the doctor, what type of a visit was it, what happened, when is the next appointment, for what purpose. So all of this is really wonderful, wonderful planning. If you don't do this and you're confining this to memory, what's going to happen is you'll be late, you'll forget, you'll miss appointments, you'll cancel appointments. The doctor may be busy and will schedule an appointment in 2 or 3 weeks or a month later. By then, the child may be sick. So you really need, part of the prevention is to follow the doctor's advice and follow established protocol and routine, and keep a record of it, keep an adequate record of it. The second prong, or another prong that I consider part of preventive service, is once you have something, my child is coughing. ¿Qué te pasa? ¿Por qué estás tosiendo? Why are you coughing? Oh, I swallowed something. Okay. The cough persists. Now, it's not that you swallowed something. Something's wrong. You're sniffling, you have a cough. At that point, the prevention means doing what? Do you wait it out? Do you administer over-the-counter medication? Do you assume the responsibilities of the physician? Or do you think it's prudent to make an appointment and have your child seen? So I see that as part of of like a second prong of the prevention. ¿Qué te parece that approach that I'm suggesting?
That is excellent. The surveillance and monitoring of a child's well-being is part of being a parent. And if something is occurring and it is abnormal, a persistent cough, a repetitive fever, an inflamed lymph node, for example, that doesn't go away. Most infections in children will produce small lymph node enlargement that subside after a few weeks. But if it's something that looks unusual, like a child that looks pale all the time and is fatigued and is losing weight, or a child that has bruises, that requires the attention of a physician. A child that has a full abdomen, and that is something that is sometimes seen. It can be due to constipation, but it can also imply another problem. So any condition that persists over weeks or months and catches the attention of a parent, paleness, bruising, fevers that cannot be explained, will alert that something needs to be evaluated in a more in-depth fashion.
Yeah. Well, just to share a personal thing from my own life, when I was about 7 years old, my mother, who was a doctor and learned pediatrics under your father, she noticed that I was limping my left leg, and I was complaining a little bit of pain. She didn't hesitate to have me evaluated, and it turned out that I had a condition known as osteochondritis of the left knee. And had it not been treated, my understanding is that I ran the risk of losing a piece of bone because there was a hole that was forming, and that if upon losing it, I might have ended up with one leg shorter than the other. So thank you, Mom, for taking care of me. She certainly did the correct thing. I also wanted to give some credit as well to one of my own workers, Brenda from my own office. She's a young mother with a young little boy and a newborn baby girl, and she is following all the required pediatric protocols, but significantly as well, not just following all the necessary recommended treatments that are age appropriate. But when she noticed that there was like a coughing or an elevated fever, she didn't sit there thinking, what should I do? Wait it out, wait another day, wait 2 days. No, she didn't hesitate to put the child at risk, and she did the correct thing by going to an emergency room, going to the pediatrician, going to the ER, pediatrics ER. So Brenda, if you're listening, a shout out to you. Well done. And I'm saying this because clearly, anybody can do this. You don't have to sit there waiting, for something serious or significant to happen. Let's look a little bit now at what are some of the emotional consequences of being sick. This is, I think, very, very significant, very important. Slide 7. So nobody likes being sick, okay? There are emotional problems that occur when a child is sick, and significantly if it's a more significant sickness or more prolonged illness, and certainly when there's hospitalization. Medical tests themselves can be invasive. The child can get scared by the tests. Imagine going into an MRI machine or a CAT scan machine or having these X-rays taken. I remember when I had to have my leg X-rayed at the age of 7, and I go into the radiology room. I wasn't too happy with that machine hovering over me. Activities may be limited. You're not able to do what you were doing before because of the illness. The child may feel different. I'm different. Something's wrong with me. They can develop a low self-esteem. Medications themselves can have side effects, can make you lethargic. You could have, stomach aches. It can certainly have some sort of an adverse reaction to the body. The child can have behavioral changes, become clingy, hanging on to the parent, glued to the hip of mom. They can become more lethargic, sad, angry, belligerent, withdrawn, and withdrawn from family, loved ones, siblings, isolated from school peers, like not interested in being involved. They can also become aggressive. Changes in eating, changes in sleeping, changes in school performance. This is always a big one. You've heard, if you've watched my show before, that I've always talked about monitoring behavioral changes, changes in your child at home, changes in sleep, changes in appetite, changes in school performance. These are things to keep an eye on. They alert us that there's something going on. Uncooperative with medical care, apathetic, loss of interest in activities, and something that I think is very potentially serious when they start talking about death. Either people around them dying, or they've seen death at the hospitals where they're at, or they're focusing maybe on death themselves. So these are some of the mental health consequences of some of the physical illnesses and hospitalization. Dr. Carlos, any comments that you'd like to add to this?
Yes, a child with a chronic condition can suffer in silence. So it is important that we pay attention. We know that the stress on a daily basis that a child endures and has to cope every day for the next day will produce all those behavioral changes that we are talking about. And these have now shown in scientific studies that it does produce structural changes in the developing brain of a child. So it is important that we do pay attention to these conditions, help these patients with a positive environment, and try to kind of make forward advances in their treatments to alleviate that pain and produce more realistic hope. And that way we'll reverse all the pain and the environment of death that we can talk about just briefly now.
So, you talked about the brain and the developing brain, and there's a lot of the brain is wonderful. I mean, it has many ways of, like, one part can sort of fill in for another part when there's something that's going on. But having, as a neuropsychologist with a neuropsychological background, I did want to mention to the viewers who may be surprised, but the brain, we're really not totally into the full development of our brain and executive functions until approximately the age of 25. So keep that in mind. You have to keep in mind it's not just children, but we're also talking about adolescence and into young adulthood. Let's look at slide 8. What can we do? How can we motivate our viewers? How can we work with the children? How can we help them cope and develop what's called resilience? So first and foremost at the top, it's important to talk to your child. And often I see parents in my own private practice, they're afraid to tell their children how they are, if they have something that's medically wrong with them, or they don't share their own medical conditions or how they are with their children. You have to be able to talk to your child. Your child is better off knowing and then being able to deal with something than imagining things or hearing whispers and wondering and developing negative thoughts and false perceptions. You need to be open and honest, reassuring, listen to the child, answer questions when they ask them, encourage them to ask questions, be able to have a dialogue. It goes without saying that, or maybe I should say, that it's important that you, obviously you need to deal with the chronological age of your child. How you talk to a 5-year-old is going to be different than how you talk to a 15-year-old. So you do have to keep your child's chronological age, development, intellectual ability, and these things have to be, you have to be aware of some of these things as well. What is resilience? Resilience basically boils down to, quite simply, the ability to bounce back from adversity. Anything that's been a life challenge, source of stress. When you face it, experience it, how you cope with it, to the extent that you develop skills to become more resilient, you bounce back in the future, it's going to make it much easier for you when you encounter the next source of stress that you likely will encounter in your life, that you'll cope with it more effectively. This list, and I'm going to go over it, it's fairly, I think it's fairly adequate, and I'm sure that you can search elsewhere, but this is, I think, a fairly comprehensive list. Teach to maintain a positive outlook. The trick is, how do you do this? If you're a parent, how do you do this? You have to smile to your child and say yes. Your boo-boo will get away. You will get better. That's why we're going to the doctor. I know it hurts. I know you don't feel well. I know you have to take the medication, but going forward, not backwards, look forwards, and you will see that you will start to feel better. That's how I would suggest approaching developing a positive outlook. Reinforce social connections. You don't want the child to be isolated and withdrawn. I listed here family, friends. It's much more. teachers, religious organizations, other sources of social associations or affiliations, sports. There's so many different art classes, music classes, walking, going to the park. There's so many different ways in which you can socialize with other people. Strengthen self-care skills and habits. Teach proper brushing the teeth, proper dieting, proper bathing. These are all dressing appropriately, keeping clean, washing your hands regularly. These are self-care skills and habits. Accept that things happen and avoid blaming. Hey, it happened. You cannot undo it. You can't say it's his fault, her fault. Again, you have to go forward. Look forward. You always have to have an eye towards we are going forward, not backwards. You cannot undo something. Given that it happened, what can we do to make it better? What can we do to make sure that it doesn't happen again, or that you deal with it better, more effectively, if and when it happens again? Work on changing that which is in your control. I give a very simple example. You cannot control the rain. If it's raining, you can't stop the rain. But you can control what you do about it yourself personally. You can get an umbrella, take the umbrella, walk out and use the umbrella. That's under your control. So work on changing that which is in your control. Develop skills to cope with stress. As a psychologist, I teach all sorts of different kinds of relaxation exercises, meditation, deep breathing. It doesn't just have to be that. It can be watching comedy shows on TV, maybe playing video games, interacting with children, with peers. I mean, going out once in a while to, pancakes, go to a diner, get a bite to eat, visit family members. These are all ways of relaxing and helping to cope with stress. Encourage talking things through. Dr. Monzon, earlier, Dr. Carlos was saying that, kids are quiet, they're silent. It could be a sign that something's wrong with them, especially if they've been more talkative before. So you want to encourage them to talk things through, ask for help. Don't be afraid to ask for help. I'm not going to punish you as your father if you come to me and you tell me that something happened or that you fell and you hurt yourself, but you tore your pants and you're afraid that I'm going to be upset because you tore your pants and I want to buy you a new pants. No, you cannot have that fear. You have to be able to come and talk and ask for help. Problem solve. Like, how do you consider options? You can certainly talk to your children. You can give them the answers, or you can ask them, what do you think we should do? How would that work? Is there something else you think we could do? How might that work? This is how you're developing problem-solving skills, not telling them. Work on helping them to further develop interests. Make sure they don't lose interests they already have, but develop new interests, new kinds of activities that they can do. Learn from mistakes and reframe. Reframe means how you think to yourself, what was the reason for the mistake, any role that you may have had in that mistake, and what you would do if you had to do it differently. What can you do to change it? Routines. It's good to have routines. When you come home and you put the keys somewhere, it's good that you put the keys in the same place, because if you don't, you're not going to find them later on. So it's good to have routines that you can fall back on and rely on. So routines can be reassuring, and you have to develop age-appropriate goals. My child is facing graduation from kindergarten. Okay, what's an age-appropriate goal for a kindergartner? What can you look forward to? Drawing, developing more drawing skills, meeting with children his or her age over the summer. Older child, well, I would like to maybe take singing lessons or dancing lessons or go for religious education. So age-appropriate kinds of goals. So I spent a lot of time talking on this. Dr. Carlos, some suggestions or thoughts?
I agree with that completely. A nurturing, caring home environment is the base for a child's mental, emotional health. So having that time, that patience, that communication with a child is crucial to know where this child is, and developing a strong relationship is fundamental in how that little mind will develop and will have those skills later on to cope with life.
But it's equally to share is that the parents who have children who are happier, more verbal, happy that you did something or that you were available when they didn't feel well, those parents are going to feel wonderful too. It's a wonderful interaction. Parents, they're suffering as well. We didn't we take another show to cover some of the emotional consequences of adults who have children who are facing illnesses, but they have significant emotional consequences as well. They might feel guilty that they missed something, that they didn't take care of a need quickly enough, or that they bought something, they shouldn't have bought that, they should have saved for this. They can have all sorts of emotional reactions, and I think that it's definitely worth mentioning that the interaction makes the family very cohesive, and having a cohesive family, a healthy family, is not just a healthy child. You want to have a healthy family. Let's take a look at the last slide, slide number 9, before Oscar here starts telling me that I've got to stop. I'm going to try to squeeze in a few more minutes. Okay. I wanted to let you know, very, very briefly at the top, medical treatment rights and resources. And I did have that statistic that I told you was very alarming at the beginning of the show. Approximately 137 million people end up at a hospital emergency room every year. That is awesome. Federal law requires Medicare-approved hospitals to provide emergency care to anyone who needs it, regardless of ability to pay. Approximately 15% of adults do not have health care coverage, and people of low socioeconomic means, I think it's maybe 1 in 4 that is unable to afford health care coverage. That doesn't mean that you don't get treatment when you need it. So if your child has a fever and you don't have that insurance card, you have to go to a hospital. Federal law mandates that they receive treatment. Parents who wish to seek more information or assistance, I've given you some sources here. American Academy of Pediatrics, Dr. Carlos had recommended this one. I gave you the website there. Also, there's a book, Building Resilience in Children and Teens, 3rd edition by Kenneth R. Ginsburg, MD, pediatrician. And it's on that site, so you can get it, you can look it up through the American Academy of Pediatrics. American Psychological Association, they have a parenting guide. I gave you the website as well, the American Psychological Association. I'm a psychologist, so I think it certainly makes a lot of sense that I give this to you. On other shows, I have mentioned that each state has psychological associations, and there's others, social workers and mental health counselors. I don't just want to, imply that only psychologists have associations, psychiatric associations. So, you're free to consider the different associations that exist. Pastoral counseling, there's many. The important thing is that you be aware of it. If you need assistance, I'm giving you a couple of simple some references here, but there are many, many, many more. What's important is look for it on the internet, ask for recommendations, don't limit yourself. National Alliance on Mental Illness, I gave you their website as well. It doesn't mean that you're dealing with somebody who requires hospitalization in a psychiatric facility. They have a lot of wonderful, wonderful resources to offer. Dr. Monzon, Carlos, some parting words before we end?
Just to underline the fact that physicians, doctors, psychologists are happy when are approached by families with questions and concerns. So that would be a step to take if the family doesn't know where to go. There's someone out there that will be willing to help. Physicians, psychologists, social workers, that's part of their role, to help families, to help and answer questions. And if they don't know, they will look it up. They will call someone and ask that other professional that may have the right answer. So it is to be aware of the ability and the openness that physicians, psychologists, social workers, and nurses ought to have to help people.
Okay, so we're coming to an end. I wanted to thank Dr. Carlos Monzon. Lo pronuncié muy bien, right? Didn't I say it well? in Spanish, it sounds so nice, Carlos Monzon. In English, Carlos Monzon. But in Spanish, se siente mucho mejor. I wanted to thank the viewers. I hope that it was of interest to you. Again, I remind you the show's being recorded. It'll be available on YouTube, Vimeo, Tribuna TV, and Facebook, and other forms of social media. And I want to encourage my viewers to come next Thursday on Halloween, October 31st. We're going to have a wonderful, wonderful show, Pets in My Family. The role of pets as a family member. So look for that. Buenas noches a todos. Thank you, Dr. Carlos, for being here. And thank you so much for your assistance and your help. Buenas noches a todos. Thank you, Oscar.